The art of caring healthcare requires skills that go beyond the discipline of medicine. The 21st century doctor has to be an expert who knows how to communicate well with patients and their families as well as with other healthcare professionals while demonstrating leadership skills and professionalism. This is why the history of medicine, philosophy, the arts and literature now form part of the Faculty of Medicine's MD program.
Our medical students will be the leaders of tomorrow. They will have to deal with difficult ethical situations. Their medical training may not be sufficient. We want to expose them to social and human sciences. We want the teachers and researchers in those fields to broaden their perspective to make them better physicians.
But what incentive is there for students to take interest in the humanities?
I was motivated to participate in this project because I believe the humanities enhances our understanding of the medical culture and the history of the profession. It allows us to better understand the persons who are treated and the society in which they live and in which we practice medicine. The humanities allows for a more holistic learning experience, and as a student, that's important to me.
Thanks to philosophical reflection, medical students can learn to have a critical look at medical practice and question their assumptions and their values. In the ethical domain, this reflection examines the nature of medical action in society and the question raised by medical progress.
The history of medicine helps students put scientific advances into perspective as they learn about the evolution of knowledge.
History of medicine provides students with ways of exploring the connections between biological processes and social processes. This helps them to reconcile and ultimately integrate a scientific approach to disease in which we necessarily have to reduce the body to its physical and chemical properties with important factors that today we call social and cultural determinants of health.
The encounter between a doctor and a patient is actually the co-writing of a common story. Narrative medicine explores, through literature and creative writing, the shared understanding which results from all the stories, medical, cultural, personal, that both participants have heard and have told.
Lastly, art appreciation forces the student to consider many interpretations. Medical practice requires the same openness.
The arts and medicine are essential to go together. They help us explore the illness experiences of our patients and their families and to appreciate the diversity of the human experience. They help us give a holistic approach to the care that we provide, and they help us improve our observational skills as well as our self-reflective skills. And they also are essential to our own personal wellness.
The Medicine and Humanities certificate can be obtained by earning credits over the 4 years of the MD program and by successfully completing a special project approved by the Medicine and Humanities Committee.